Around January of 2015, I started to have some pain in my left hip.
Because it actually started when I was in Costco, and I noticed a big black spot in my eyesight.
When I established a new primary care doctor, she said, "Why are you anemic?" And I said, "I just am." And she said, "No, there needs to be a why."
Eventually, I ended up getting an x-ray, and I kind of within a few seconds recognized that I have a big hole in my hip bone. And so in an instant, before anybody else knew, before the x-ray technician knew, or before the radiologist knew, I knew I had cancer.
It's 4/17/2015, and this is what my blood looks like about 9.5 to 10 hours after starting Decadron.
Myeloma is a huge gamut of a disease. You know, it's like apples and oranges and pears all put together, and we call it fruit. And it's nice to find somebody who has bananas just like you, that you can see how they did and, you know, plan your life around it.
Just the idea of people that have the similar disease all being together and sharing their ideas, and people who've had it longer than me being able to mentor me, for lack of a better word.
All4Cure's building a knowledge-sharing platform so that the experience of every patient with cancer counts.
We have the information available out there. It's just that putting it all together is so dysfunctional, so disorganized, and so scattered.
The way our platform works is patients send a request to their oncologist's office that their medical records be sent to us at All4Cure. From the medical records, we pull out information that we use to create a patient's dashboard. So we refer to each patient with a unique code rather than their name, and it's that information that forms the basis then for discussions by a community of experts and other patients.
Each person's journey with cancer is different, and sharing that journey gives other people not only insight, gives them hope, gives them the concept of a future.
We're not going to cure cancer by some brilliant scientist in the lab finding a pill that works for everyone. We're going to cure cancer by learning from everyone's experience, recording it, and getting incrementally smarter with every patient's experience. And that's what I believe All4Cure can achieve, and that's what I'm committed to doing. We have a prototype that we've demonstrated is feasible. We know that many patients are highly enthusiastic about participating in this work. Now we need to scale, and we want to scale to 500 patients. To scale to 500 patients is going to require substantial resources that will allow us to hire people on the IT front who can help us extract information from medical records in a more efficient way, and from clinical scientists who can extract additional information, but who can also look at the patient's situations and suggest clinical trials, treatments, or reach out to experts to provide additional contributions to bringing the best input that we can possibly provide to the patients who have entrusted their information to us. So we welcome the people that are watching this video to join us in this journey that I believe will eventually allow us to cure cancer.